conditions. So typically speaking, when you get to the levels of management, it is white managers who are making these calls. And I have lots of anecdotal evidence from people who work within the health service that actually all the tough calls fall on the black and minority ethnic staff. Now, it would be okay if they could find the voice to reject these things. But the truth is, they don't have the authority, either socially or professionally, to prevail upon their bosses to give them what effectively would be a fair shake. So basically, I mean, they're damned if they do and they're damned if they don't. They don't get a choice in whether or not they get the PPE. They don't get a choice in whether or not they are exposed. And so the mortality rate from COVID within the National Health Service will naturally reflect the risks they are being made to take and which they can't seem to resist.
Umar, then I'm trying to understand that. Why this BAME staff that knows that it's at a disadvantage right now when it comes to accessing PPE, why haven't they been more vocal, or have they been vocal and have they just been stopped, as Tetteh there said? I mean, in the sense that they don't have an outlet where to complain and where to actually have their voices heard, because you would think that because so much of NHS staff is BAME, that they would be able to almost unite and almost create enough chaos to ensure that they're protected?
Yeah, I mean, there's a number of different reasons as to why this would be the case. I mean, statistically speaking, you're more likely to find BAME people being bank staff in the NHS as well. So there's that fear of not wanting to rock the boat too much to avoid not being able to get shift work, subsequently being able to assist at home. There are organisations within the NHS, and I do think and I do believe that this matter is being raised more and more on a wider level. And I think we have to also look at the fact that statistically, the government